Hey guys, I'm back. Back from vacation and also getting over a cold. That's why I haven't been doing any live YouTube here the last week or so. Although I did do a little bit from YouTube Space LA when I was there for my orientation for unlocking the space, meaning being able to use their facilities. Hey, Brianna Awesomeness, we are so glad to have you join us here this evening. And Lita131, glad to have you here also. And we can make this time whatever you guys want it to be. We can go ahead and talk about medical topics. We can talk about medical business or policy. Hey, Pamela, good to see you, and your hubby. And I know that's who it is because you told us when I referred to your picture with him. Anybody else out there? Anybody from East Coast or from across the Atlantic or across the Pacific? Let us know. We'd like to see where you guys are from and join in the conversation. Right now we have participation from Pamela and our other two friends who have already told us that they're with us. Pamela, yes, I try to remember my people who participate in our community. Hillary Allen from Ontario. Okay, so we are getting some people from further away and in later time zones. And we have Twilla Girl from Florida and GR 2065 from Miami, Florida. LaDonia Diaz from Mississippi, again, thank you. And Cindy Hayes from North Carolina. And Petra, hi Petra, how are you doing? How are you healing up? I assume you're out of the hospital and home now. Let us know. I would guess you're probably on some oral antibiotics. And if you want me to tell people what you've been going through, give me permission. Otherwise, I'll hold it off at that. We also have greetings from Rebecca Charbonneau in Canada. Cool. Becky Clay. Hi, Becky. And Linda Tomowski from Hugo, Colorado. Oh my goodness, it's 3:52 in the morning. Petra, I hope I didn't wake you with some kind of alert that we were going live when that you participated. Brianna Awesomeness is from Indiana. Petra's not doing good. I'm sorry, Petra. And we can talk about your situation if you want. Sharon Calvert from MS. MS. Is MS Mississippi? I think it is. GR 2065 gives us lots of thumbs up. Petra, it's okay, you can tell. Okay, we'll talk about that. And Linda Tomowski says it's a great idea to. Oh, I'm glad you like it. Okay, so Petra had a hysterectomy and then got a wound infection, had to go back in the hospital and was very sick and now still isn't in the clear. So you can add in whatever details you want, Petra, there. And of course, everybody will be thinking about you and praying for you as you go through your recovery. Sharon Calvert also saying yes. LaDonia Diaz, yes. I'm glad you guys like the live chat. Oh, talking about Mississippi. That's what you guys are saying yes to. That I got the right state. Because MS is Mississippi, MI is Michigan, and MN is Minnesota, I think. Is that all the M states? I'm pretty sure it's pretty good. So she got septic. That's Petra we're talking about, who had the wound infection after hysterectomy. Septic meaning that bacteria that were in the wound causing the infection got in her blood, and then systemically were making her ill, and that's a bad situation, needs to be treated with IV antibiotics, which she was treated with and was even hospitalized for it. Cindy, sorry about Petra's infection. Brianna Awesomeness answering the earlier question. Mela Farmer, South Carolina. Welcome, Mela. We're glad to have you here. Pamela praying for Petra also. And East Tennessee, Audrey, me again. Yes, Audrey, we are glad to see you. And Audrey, I do recognize you from your comments on videos too. And yes, Petra saying thank you. GR 2065, best of luck. Petra ended up in Mercy hysterectomy. Oh, you did too, GR 2065. Yeah, sorry that happened. So we've got a good bunch of people here participating this evening. We'll probably have more people drop in as the evening goes on because of the announcements that get out, not only on YouTube, but also my Twitter and my Facebook. Brianna Awesomeness, 9:55 in Indiana. Yes, it's a little later there. As far as the notifications on Twitter and Facebook, if you guys don't follow Auburn Medical Group on Facebook or Dr. Vaughan on Twitter, you can find those there. Billy Goat 126, thank you for coming. Glad to have you here also. I forgot where you're from, Billy Goat 126. You've told me before. And of course, I always think Idaho because of your what do you call it? Your avatar with Napoleon Dynamite. So you guys are welcome to give thumbs up. You're welcome to give super chats if you want. Of course, if you do a super chat, you'll get special attention, or you can just comment. We appreciate that too. So we have Christina Hartman. Hi, Christina. Orange County. Okay, Orange County, which interesting. I was just having a conversation about Orange County with my son, who's out now, and Linda Tomowski, the thumbs up. Santa Ana specifically, which is kind of, I guess, the heart of Orange County, I guess. Alita 131, I have my essential oil diffuser on with lavender. It smells so good and relaxing, helps me sleep. Excellent, very good, Alita. And we were talking about, Orange County specifically, talking about Chapman University, because he has a friend going there. Petra, update here. They are still draining my stomach every day, and it hurts so bad. Thank God for morphine sometimes. Yes, it's appropriate for acute pain like you're going through. Draining your stomach, is that through a tube down the nose, or is that like a JP, something that's coming out of your abdominal wound drain? I'm assuming it's a wound drain rather than NP. And Jonathan's from Los Angeles. We were just in Los Angeles, down at YouTube Space, and also visiting my son at UCLA. What else did we do in LA? Good restaurants, that's what we did. And, of course, Lisa got to go to the beach at Santa Monica. She loves that. Smarton Tyler from Beaumont, Texas. Brianna Osmus has really bad eczema. Lita 131 likes watching pimple popping videos. A wound drain. Okay, thank you, Petra. Billy got 126. Don't want to be annoying, but ask what you had for lunch this time. You always cause trouble with that question. Okay, lunch today. Lunch today was. No, I'm not gonna get. I was gonna get it out of the pantry. Oh, hey, Lindsay. Good to see you there. Little Hawaiian. What are they called? Hawaiian buns. Is that what you call them? The little bread buns with ham left over from Easter, and some mustard, maybe something else, maybe some mayonnaise on it. Not the healthiest, that super white bread that's simple carbohydrates I could use less of. And a banana and water to drink. Linda Tomowski, love the pimple pop. Oh, we already did that. Christina Hartman, Ontario, thank you for coming. Brianna Osmanus, Hawaiian rolls. Yes, thank you. Hawaiian rolls. Why couldn't I come up with that? I don't know why. Lindsay, of course, I'm used to saying your name and also BooBoo Kitty's name, because you guys are at that Patreon level where I actually say your name on videos. And a lot of people are at the level where you actually get your name in the description of videos. In fact, the description of this has Lindsay and BooBoo Kitty and all the other people that are at the $5 level and above. They get their names on the regular videos in the description. Petra, hope you had better breakfast when you're at YouTube. Yes, breakfast was, it was cinnamon rolls. Lita 131, my mom was just talking about those sandwiches the other day. She makes them all the time. She loves them. And Billy got 122, not bad for being so connected with his doctor. Brianna Osmanus, Friday's my birthday. Happy birthday, Brianna. We're all singing happy birthday to you in our own separate areas. That's why I'm not going to do it out loud, because it would be a solo with the way the YouTube chat works. Wanda Ryan, hi from Wanda in Texas. Wow, another person from Texas. Linda, my husband and I gave up meat, bread, sugar for Lent. He lost 1 pound a day for a total of 46 pounds. I hope he keeps it off. I have a little comment to make on that. I have some friends who are vegan for short periods of time. And there's a problem, because apparently you can eat lots of simple carbohydrates, including Oreos, and still be vegan. So let's not consider vegan to be necessarily healthy. I'd prefer people to pursue the low carbohydrate route, consistent with the Atkins or the South Beach or the jungle diet or the paleo diet. Those all are kind of on the same theme of avoiding simple carbohydrates, starches and sweets, that sort of thing. And don't drink your calories. That's soda and alcohol and energy drinks. And limit the fruit juice too, by the way. Okay, backing up a little bit. But congratulations, Linda and Linda's husband. Petra, happy birthday, Brianna. Billy Goat 126. What did you miss most from work? Should I say Dr. Gwaine? Brianna Osmus, my brother is vegan. He has been vegan for a year. I hope he does the healthy vegan and not what my friends did. They're including Oreos in their vegan diet. Melissa DiMartino. Oh, Melissa, you have a special place because you did you were our first super chat. Hi, Dr. Vaughan. Nice job, Linda. Yes, it was a nice job. Okay, and Linda saying thank you. Of course, back to Melissa DiMartini. the special Melissa DeMartini. Do you guys hear any noise? The dishwasher's running. I don't know if it interferes with the audio or not. Let me know. If I'm quiet, it's because I'm laying knitting because I can't sleep. Okay, so it's not my fault you can't sleep, I hope, with some kind of notification that we went live. But I'm glad you're able to do the knitting. That's really good. And don't worry, you don't have to say anything more. We know you're there, and we're thinking about you. Audrey, what's the best way to lose belly fat? Pamela's not hearing any noise from the burping sink with the dishwasher. Brianna, awesomeness, no. Gemma Herod, hi, Jamil. Jonathan Langford, didn't notice the noise until you mentioned it. Yeah, Jonathan, it was my fault for mentioning it. GR2 2065, but soda's so good. Oh, you know what? You get away from soda and you don't miss it so much after a while. It takes a while, but it just doesn't have that hold on you that it does when you first try to get away from it. Billy Goat 126, do you have any secret hobbies? May not know about secret hobbies. Yeah, watching YouTube. Billy Goat 126, Petra, it's because of the pain. Okay, yeah, I'm sorry you're hurting. Sharon Calvert, good for you, Petra. All right, backing up to whatever it was Audrey had commented on. What is the best way to lose belly fat? Well, you can't, as much as you'll see advertisements and people trying to sell you stuff. Notice I'm not selling anything at all here. People who try to sell you stuff will tell you ways to lose belly fat. Honestly, there's nothing that's specific to the belly fat. You lose fat in general when you lose fat by eating less than you're spending as far as calories, or some kind of combination of that and spending more calories than you're eating. But it's really more on the eating end that you lose the weight. The exercise is more for the fitness and toning, but doing them both together is recommended. But it's more the eating that's going to help you to lose the fat. And it's going to be from everywhere, not just the belly. And then something that will help your belly is doing exercises for the abdominal muscles that help to tone it to make it look better. But you're not going to specifically target loss from that. There is one way you can, and that would be to specifically go in and take it out, which would be liposuction or tummy tucks. And I guess you can do those. I just recommend doing non-surgical and healthier solutions, because it's just going to come back if you're having the same lifestyle anyway. Yeah, all right, backing up. I'm going to get to your Billy Goat 126 comment there. Enjoy ear cleaning. Smart and Tyler enjoy ear cleaning videos. Having ear infections more often in the family. My mom, children, myself suffer from the two to three times a year ear infections. That just doesn't sound normal. I would probably at some point get referred to an ENT specialist, get that checked out. Great question, Susan. Brianna, awesomeness. Smart and Tyler. Favorite movie? Oh, of course, Indiana Jones. What was the first one? Raiders of the Lost Ark comes to mind as one of my earliest favorite movies. More recently, in 1999, actually I didn't see it in 99, I didn't see it till 2000. The Matrix was a favorite for a long time. Nowadays, I don't like the shoot 'em up action movies. I like things that are more thoughtful and have more story to them, rather than just action and eye candy of visual stimulation. Which is interesting that I have videos that are just, visual stimulation, like the pimple popping, the ear cleaning. I enjoy those, but I have a preference for the meatier, more meaningful medical videos that I make. So I hadn't really thought about the similarities between movies I like and my change over my life and the videos we make on YouTube and preferences there. How's it going? Well, Autumn Lawson is going awesome. Petra, you missed Susan's questions about prednisone. Oh, I did. Well, let's back up a little bit. There was a question about prednisone. I must have missed it because I'm going back, because I'm not going back far enough, because I'm not finding it. Any special tips for losing weight from being on long-term prednisone? Prednisone, okay, this could be unique, Susan. Prednisone can cause a special kind of weight, or not weight, but it causes weight gain in general because it increases appetite. But the High levels of corticosteroids, like prednisone, can cause development of a buffalo hump. That's right in the middle of the back. It's a collection of what's called brown fat that collects in specific areas of the body. In humans, it can happen right between the shoulder blades. They call it a buffalo hump, which isn't a very nice name for it, but it does resemble kind of the hump on a buffalo. And it is brown fat. It is different. We see it specifically in Cushing's syndrome, along with the other parts of that syndrome. But buffalo hump, that collection of brown fat is something that's specific to that. I don't know of a way to specifically lose that kind of fat. But if it's just prednisone, it's actually weight gained all over the body, and it's just like everything else. The way to get rid of it is less calories coming in than you're using. So, and the best way to do that is through, don't drink your calories, avoid the sweets and the starches. All right, backing up and getting caught up with your comments and questions. Call to midwife? No. We all had tubes from ENT, told we have narrow passage. Oh, so you may have some congenital abnormality contributing to that common ear infection you guys are having. Pamela, what about treatment for eczema, steroid cream not working? People with severe eczema can go with higher potency steroid creams and putting saran wrap on the steroid cream. Usually primary care can handle the prescriptions for these higher potency steroid creams. There's also chemotherapy with things like Elidil, although people are a little shy of using it because of its association with certain types of cancers. And I understand why you would be a little hesitant to use it, but that would also be considered. Backing up to Melissa, that's one of my favorite shows. Are you talking about the favorite movies? Petra, got it. Susan, Greyhound. I've also developed osteoporosis from the prednisone. Yes, prednisone over time can do that, can mess up your stomach, can cause a weight gain, it can cause psychosis. Lots of things that prednisone can do, and it can cause you to not have enough natural corticosteroid from your adrenal glands because of decreased production of cortisone, natural cortisone, if you take it for a while, especially if you're older or frail or in a weakened condition. Lindsay, I could talk for literally days on the subject of eczema. You should get together with, who was it? Who was it asking about? I can't even find who it was. Anyway, Pamela. So you two get together. Petra, did you have a nice Eastern? And Melissa, dear. Oh, you like both of the shows. Okay, Billy Goat 126, love listening and watching your videos while I study, do homework. Hey, that's pretty cool. I'm glad you're able to do both at the same time. I never could do anything and study. I had to be all just focus on studying when I was studying. Pamela, thanks. Does Sjogren's play any part in eczema? Sjogren's being a connective tissue disorder, which is related to a autoimmune disease that affects especially mucous membranes and some other specific parts of the body. Any part in asthma? I don't know of a connection between the two. Billy 126 keeps me motivated. Wanda, what causes kidney stones? Usually oxalic acid or oxalate. And you can look that up on Google to find foods that are rich in oxalate to know what to avoid. Don't avoid calcium because it's calcium oxalate. Calcium's not the problem, it's the oxalate that's the problem. Lindsay, Pamela, a potent steroid cream I've had success with is fluocinamide. That is a potent one. Anna Marietta, what do you think about essential oils for treat eczema? You know what? The essential oils have been studied, and we don't find in objective studies that they really do anything more than placebos for helping whatever it is you're trying to help with them. Melissa DiMartini, yes, happy resurrection. Yes, happy resurrection day late to you too. Teresa Boying, I have a AAA. Why do doctors wait until 5 centimeters before they do anything for surgery for it? There's a reason to wait 5 centimeters. Because the mortality rate from the surgery to correct it is very high. It's a very dangerous operation. So, to operate before 5 centimeters, the rate of people dying from the operation is unacceptable. That's why. Bummer. Thanks, Lindsay. Billy, go. Any tips on preventing lateral epicondylitis? That's on this side rather than this side. It's also called tennis elbow. And the answer is to stop doing whatever is causing you to do this action or this action, because the supinators and the wrist extensors attach on the lateral epicondyle here, and after a lot of repetitive use of this sort of thing, you get inflammation at this location of the tendon here, a bit of a tendonitis, called tennis elbow because of the backhand in tennis. Medial epicondylitis is called golfer's elbow because of the elbow swing. And it's more related to palmar flexion or flexion of the wrist and supination. All right. Teresa, you are welcome. Petra, I have Addison, so I have prednisone daily and something called Solucori, probably much like our Solumedrol, I would guess. Something called Solucori, something. My body doesn't produce any cortisol at all. You are the opposite. Petra has the opposite condition of what I was saying earlier about Cushing syndrome. She has anti-Cushing syndrome or Addison disease, where her body doesn't produce natural cortisol. Lindsay, you're welcome. You could also ask your doctor about triamcinolone. Triamcinolone is a medium potency steroid, although you can get, you can get 0.1%, which is low potency, 0.5%, which is medium potency, and you can make it higher potency by covering it with saran wrap too. You can get the cheap stuff and do that. So triamcinolone is inexpensive and can function as several different potencies of steroid cream. Oh, somebody's here. Who's here?
Hello.
It's Lisa. Everybody say hi to Lisa.
Hello.
They're excited that you're here, Lisa. It's not as strong. It's always better to start slower. Yes, it is. Especially since steroids cause discoloration of the skin, especially facial skin. We really don't like people using steroids on their face. And, people are saying hi to you. Somebody from Sweden is saying hi to you.
I went to Germany.
It's like 4 o'clock in the morning there.
I've been to Germany.
She's been to Germany. And Melissa DiMartino. Oh, yeah, do you want that?
Yeah.
That's what we had. And then there's chips up there. And we have baby carrots and strawberries are in the refrigerator too.
Okay.
Sorry, guys. I'll come back. Really, I'm not ignoring you. Lisa missed dinner, so helping her. And Teresa says hi. And Pamela says hi.
Hi.
And Petra says hi from Sweden.
Hi.
And Melissa says hi. I guess that's everybody saying hi to Lisa. Do you have any questions specific for Lisa? Least favorite rotation in med school. Okay, that's going to be different between medical school and residency. Least favorite in medical school. Least favorite rotation. So in my 3rd and 4th year when I did my clinical rotations in medical school, I'd probably say either medicine or surgery. And that's because of call at the VA, which was very lonely because that place is a ghost town after hours, especially on the weekends. And it's just you. And somewhere there's a resident supervising you who doesn't want to be around you and doesn't like you and doesn't talk to you. So it gets very lonely. And gets lonely for your wife who's at home too while you're on that rotation. So I would say both medicine and surgery when I was at the VA hospital. Lindsay, Pamela, if you'd like to look me up on Facebook under Lindsay Graff. Pamela, Lisa, what's it like to have a doctor for a dad? That's what Pamela asked.
It actually really comes in handy because if I have any medical questions, I can just ask him, and he sometimes brings the flu shots home for me, so I don't have to go to the doctor. And he saves the squirt up my nose, so I don't have to get real shots.
Because you can get a nasal flu vaccine instead of having to get the shot. She prefers that. Not indicated at all for people over the age of 50. All right, getting caught up with your comments there. Lindsay, I've dealt with this condition my entire life. We can put our heads together. Crystal M, hello. Glad you are doing your live feed again this week. Yes, Crystal, we're glad to be doing it. It's fun to do it. Pamela, okay, Lindsay. Anna Marietta, that's amazing, LOL. Pamela, that's great. Christina Hartman, What is a pilonidal sinus disease? Pilonidal sinuses are these pits, these gland ducts that get infected right above the butthole, right in the crack, and they stink when you open them and clean them out. I have not done a pilonidal sinus, and I don't know how long. And some people are just more prone to them than others. Crystal, that's a great perk. Billy Goat 126. Is she also interested in medicine? No, Lisa's not going that direction. Her sister Kara is. Petra, if any wanna, backing up to Petra again, you want to add me on Facebook, my name is the same here. I have short blonde hair on my picture. Yes, your pictures look different, Petra, by the way. I have noticed that. Wanda Ryan, what causes gout? Crystals, which are actually little rocks, crystals in the joint space. Could you imagine something more painful than having a little rock between these bones? Horrible. Specifically uric acid crystals, because for whatever reason, people aren't clearing it out, and usually associated with certain types of food, like certain types of wines, beers, cheeses, aged meats. Some people call it rich people's disease because it used to be royalty and people who could afford those type of foods who used to get it. Susan Greyhound, the reason I'm on prednisone is I have autoimmune disease and NSIP, also on CellCept. Do you know if there's any correlation between autoimmune disease and GMO? No. And I doubt that we would find any, knowing what I do about GMO. Cheryl McNutt, good evening. Anna Marietta, do you have experience with patients with tonsil stones? Not a whole lot. Any recommendations? Just take them out when they happen. I mean, that's, if it's bad enough, tonsillectomy. Sorry, not much help on that. Thinking about tonsillectomy. If they're bad enough, they affect you. For those of you who don't know what tonsil stones are, cool videos. Who had really cool tonsil stones on, John Gilmore, Dr. John Gilmore. He's got some tonsil stone removals. I don't know why he gets these two really cool ones, like almost back to back, and I've never, ever taken a tonsil stone out clinically. I'd love to, but I don't know why. I guess my patients just don't get them. Strange. All right. Sharon Calvert, gout is why I'm knitting tonight. Oh, I'm sorry. Pamela, my daughter had pilonidal cyst removed. It was very painful. We had to change the packing daily, and then it healed. Hopefully she doesn't have another one. Sharon, the reason I can't sleep. Christina Hartman, I had one when I was 17 that cut it out. I'm assuming you're referring to pilonidal cyst and not tonsil stone. Tonsil stones, it's just food matter that gets stuck in these crypts or openings in people's tonsils. And people with big tonsils are more subject to it. And it's worse when you're sick and they're inflamed and swollen. Stuff gets stuck in there easier. And the crypts get deeper. And taking them out is problematic because, well, it can go down your airway when you pop them out because it's all sticky back there and there's lots of mucus and they're hard to get unless you grab them. They don't really stick to things you stick back there because they're stuck to the mucus and they slip down in the throat. Susan Greyhound, your patients probably don't get tonsil stones because they're afraid you'll use the ear irrigator in their tonsils. Okay, I wouldn't do that. Holly, good to see you this evening, Holly. This is your first comment on the live one for quite some time. What do you know about the Botox shots for migraines? I missed your show on that. I didn't have a show on the Botox shots. Botox is used as a preventive. From the comments that we got on the video where we did the lidocaine blocks on the occipital nerves, it looks like people are having trouble with insurance covering those injections. They're preventive, and you have to go in every couple months, 3 months, to get them redone. And they Botox is a paralytic. It paralyzes your muscles, and so they paralyze muscles that are causing muscle tension that is the trigger for people's migraines. And it can be overdone. I have had a patient whose head couldn't hold up until the Botox wore off, so for months she was, like that. That's rare for that to happen. I'm not quite sure why that happened. It wasn't me who gave it. I've never given Botox. I haven't been trained in it. I chose to. Actually, I could have done Botox. It was either Botox or the trigeminal nerve branch nerve block training. I did the nerve block training instead, which treats for acute migraine when somebody's having it rather than prevents it. I wanted to start with that. I would have loved to have done both. If I could have done both, I would have done both. I may yet do the Botox training. We'll see. Also, the reason I went with the nerve block training was because I already do nerve blocks and I already have the medicine for it. I wouldn't have to purchase Botox. Pamela, oh, Susan Gray, I'm kidding. Okay. Cheryl, that was a great show. Thank you, Lisa Jimenez. That was a cool one to do, especially after having gone to the conference, gotten a new skill, being able to share it with a patient who is still migraine-free, the last I heard, by the way. Although I was told by my biller that we're having trouble getting the procedure paid for, but it's because I did so many different ones and build it under different things instead of just occipital neuralgia. I think we got it fixed. We'll find out. Lisa Jimenez, is it common to have ongoing diarrhea after having gallbladder removed nearly a year? More so in people that have more fat in their diets. Not usual, but not unheard of. Petra wants to know, is it yummy, Lisa?
Yes.
Okay, she answers yes. I don't know if you hear her from back there or not. And Cheryl McNutt, lactose intolerance. Holly Freya, what I remember. That's what I remember. I see a doctor for that on Wednesday. I'm desperate. What made you get into this? Lexi's life. Holly Freya, thank you for the info. Teresa Boring, I have a question for you. How do I get my doctor to listen to me? I have lupus, SLE, and trying to get my doctor's attention away from their computer to even listen to what's going on with me. I am so sorry about the computers. We fight it ourselves, and short of just taking their head and making them make eye contact with you, it's a tough one. We have to document so much, and some computer systems are so archaic. Ours is one of them, the Epic system, where you have to just, instead of having it set up to do things doctors do, you have to do all these manual things instead of having it automated like it should be. It's very frustrating on our end, very frustrating on your end, feeling like you're having quality communication when so much time is spent tapping away at all these different buttons. I apologize. The solution is different computer systems. We actually switched from one that was better to one that's worse, but the benefit we got was better ordering of labs and imaging and better integration with all the other doctors in town. So it was worth it in the end, but I'm just hoping they improve it and those people at Epic learn from the people at eClinicalWorks how to make a good computer system. All right, that was Teresa. Melissa DiMartino, I've had real sensitivity to sound lately. My PC will see me tomorrow, follow up. The fan bothers me, whispers, loud noises. Do I have a tear in my eardrum? Quite bothers me. No, quite the opposite. Tear in your eardrum would make you less sensitive to sounds. There's some different things that need to be looked into. Your doctor will go into all of these. One of the things that even needs to be considered is a form of migraine, of all things, really. Yeah. And some other things, some serious, some not so serious, but needs to be checked. And coming back to Petra with a thumbs up, Wanda Ryan, what causes factor 5? Petra, my husband has lupus too, it sucks. Look out, 126, what kind of music is your favorite? What kind of music? I still like music from the 80s. I still listen to Duran Duran. I like St. Lucia. Capital Cities. What music do I like, Lisa?
Do you like Lord?
Some Lord.
Alt J?
I don't know Alt J.
Daft Punk? Justice?
Some Daft Punk.
Justice?
Oh, I like some Justice too.
Muse?
I like some Muse, although I haven't gotten into their latest album yet. But
Mike Snow?
oh yeah, I like Mike Snow. What else do I like? Steve Taylor and the Perfect Foil, one of my all-time favorite. Actually, the Perfect Foil is the name of his band now. He used to be called Steve Taylor in some band. And they have a couple new songs on a limited release. Okay, Melissa DiMartino, wow. Susan Brown, talking to Melissa, well, I have sensitivity to sound when I had a high heart rate. 80s music, Pamela, yes. Melissa, I can see that. Holly also likes the 80s. Teresa Boring, yes, it does. Petra, I've read It's Worse for Guys. Okay, maybe I can help with something I skipped by. I apologize for the people I just kind of just go right over. There's some things that are more fun to answer than others. Cheryl McNutt asked about lactose intolerance, where people can't break lactose into, what's lactose made out of? Sucrose and glucose, I believe. No, I'm sorry. Sucrose is a glucose and fructose. Lactose is, it's another disaccharide made out of two monosaccharides. Monosaccharides are glucose and fructose. Is there another monosaccharide? Anyway, and some people can't separate it into the component monosaccharides, and so they have this sugar that can't get absorbed, and it stays in the gut. And sugar is osmotically active, meaning it pulls free water in through a semipermeable membrane, the intestines, and so they have more water coming into their intestines, which results in cramping and diarrhea. And some people just don't have that lactase, the enzyme that breaks down the lactose, and so they can get it by taking Lactaid tablets with their foods that contain lactose, which is milk sugar, so milk products, dairy products. All right. Oh, a 70s kid here before. Teresa. Yes, it does. Petra, I've read this Worse for Guys. Did you ever pick up any instruments? Oh, yeah. Keyboards, piano. I've tried a little guitar, but I don't have any calluses right now, so obviously I haven't done it in a long time. Never did much guitar. Lisa Jimenez. I'm lactose intolerant, so I do avoid all forms of that. Had the problem before I got the gallbladder, though. Yeah, you had that problem before, so that wasn't caused by the gallbladder. So see, I did catch up on a comment I'd skipped over. That was cool. You guys have been great. It's been 37 minutes. We've had a great time. I appreciate all of you guys. We'll do it again sometime. I still don't have a regular schedule for the chats for the YouTube Live, but it's fun, and I'll keep doing it and keep considering getting a regular schedule. And I'm also considering, for those of you who know my radio show, Medically Speaking Radio, Larry, my partner on that, I'm considering getting him in on live YouTube so that we could do it at a regular time. We used to do the show on Saturday mornings. I think it was 10 a.m. Pacific time. So that's something that I'd be glad you guys can comment or comment or tweet comments about the idea of Medically Speaking Radio making a comeback with the Mark and Larry show. It would be both of us. He's not a doctor, but we talk about medical topics and we answer questions, kind of like what I'm doing here, except it's two of us. Much more entertaining when Larry's a part of it. Okay, let me get caught up on your final comments here. Take care, Cheryl. Hey, you are welcome, Wanda. Melissa, thanks. It's been fun. Susan, you're welcome. Holly, it's welcome. Petra, I have to ask, I've gotten a really bad cough the last few days. Haven't met anyone who has cold. I have only met medical staff. I've been blowing thing I use for not getting pneumonia on antibiotics. Still, should I worry about the cough? You should get your lungs listened to by your doctor. Make sure they can't hear sounds of pneumonia. And look out for fever coming back. You're on the antibiotics, so it should be covered. Most likely it's going to be covered by the antibiotics you're on for the wound infection, though. If you're feeling sicker, having trouble breathing, yes, you should be concerned about it. Sharon, have a great night. 12 or 20, thank you for your time. Absolutely, 12 girl. Natalie, hi. Kenneth, thumbs up. Thanks for the best. Billy Goat 126, thank you. Pamela, thank you. Crystal, have a good night. Yes, you too. Teresa Boring, have a good night. Melissa DiMartino, bye, Dr. Vine and Lisa. Yes, bye, all you guys. Thank you so much. It's been a blast. Appreciate you guys.